Hi, my name is Shaylee Marshall, and today I'm going to be performing my IV start and initiate skill today. Before I begin, I'm going to do my general principles and safety practices, do my 11 rights and 3 checks. I'm going to make sure that I have all the equipment that I need, and I'm going to start by spiking my bag and priming my tubing. So I'm going to grab my clean tubing, make sure it's untangled, grab my bag, making sure that I maintain asepsis. I'm going to take the cap off of my bag and my spike, making sure I'm not contaminating either end, and spike my bag, hang it back up. I'm going to fill the chamber about halfway, and then I'm going to prime my tubing. I'm going to unclamp it, make sure all the air bubbles are out. Once that's good, I'm going to clamp it back and hang it up so it stays clean. Okay, now I'm going to come over here and get my J-loop set up. I'm going to attach the flush to the end of the J-loop and prime it, get all the air out. Once that's primed, I'm going to come over here to the patient and palpate for an appropriate vein. Once I've done that, I'm going to perform some hand hygiene and put on a pair of clean gloves. Okay, I'm going to tie my tourniquet 3 to 4 inches above the insertion site. I'm going to check for a radial pulse. It's good. Now I'm going to cleanse the site with a facility-proof cleaning solution, and I'm going to allow that to air dry. I'm going to select the appropriate needle, take the cap off. I'm going to insert the needle at a 10 to 15 degree angle. Once I get that flashback, I'm going to advance and pop my tourniquet, and then I'm going to advance the catheter. I'm going to engage the safety on my needle and place that into the sharps. I'm going to get my prime J-loop, take the cap off of it, and attach that to the end. Okay. I'm going to aspirate and pull back, looking for blood return and looking for any signs of infiltration. And flush it again, make sure it's all good. Once I do that, I'm going to tape down my catheter. Make sure that's stabilized. Okay, now I'm going to get my Tegaderm. Place my Tegaderm on top. And then I'm going to initial and time and date it and put the gauge on it per facility policy. And once I do that, I would tape up my IV with any other transparent dressings or tape if necessary. Now once I've done that, I am going to set up my IV fluids. I'm going to take an alcohol swab, and I'm going to scrub the hub of the catheter. I'm going to take my clean end of my IV tubing, take off the cap, making sure I'm not touching either end. I'm going to insert that to the hub. I'm going to unclamp it, and I'm going to set the flow rate on the IV pump per order, and I'm going to let that run. As that's running, I'm going to assess for any signs of infiltration and make sure I assess the patient's response to this procedure. Once I'm done, I'm going to take off my gloves, perform my hand hygiene, and come back within an appropriate amount of time to reassess my patient, and then I'm going to immediately document and record.